I am no stranger to adversity, and obstacles over the years have become like second nature. But one thing for sure that I kept in mind throughout each of those hurdles is that I had to keep going. Every step you take is part of your path, part of your destiny. I knew back in the 8th grade I wanted to enter the health field after watching my grandmother go through her years and years of her battle with breast cancer and later losing her battle in 2009. I knew then I wanted to do research and I wanted to be in the health field. I knew then I wanted to know why African American women were dying at such alarmingly higher rates to breast cancer than any other race. So I went on and I went to school and I went to the University of Texas at Austin, and I was a biology major, pre-med, and I started off the semester so strong, so excited, so thrilled to get started. Another hurdle pops up and my grandfather passes away with his battle with leukemia. Fast forward a few months later, I go home for the Thanksgiving break and my very own brother passes away during a domestic violence incident in which he was a bystander of. This is all within the first semester of college. Imagine being a freshman, losing your grandfather, then losing your brother, attending a funeral right after Thanksgiving break, then deciding to study for final exams. That was me. A 4.0 high school student was finishing her first semester of college with a 2.0. I remember my mom talking to me and saying, "Morgan, do you really want to go back to school? Like, you don't have to. You can take the semester off." And I told her, no. I know I failed those classes, but I know I have to keep going. And that's exactly what I did. That next semester, I became a TA for a class that I failed a final exam for. The professor recognized just how hard I had worked that entire semester, understood my situation, and then wanted me to teach his students that following semester. I had a lot of other hurdles along the way throughout my undergraduate experience, but I kept going forward. And I knew that my purpose and my destiny was being aligned right before my very eyes. Throughout my undergraduate experience is also when I realized that I wanted to go into public health. As an African American and a woman, I didn't see that many people who looked like me in the health field, and I knew I needed to be present. So I go on to attend Texas A&amp School of Public Health to receive my Master's of Public Health. And I had an amazing experience. I blossomed into the researcher I am today, the public health practitioner I have become, and I've learned so many skill sets. But to my surprise, yet another obstacle would come my way. The summer before my final semester of school, my boyfriend gets involved in a very serious motor vehicle accident. He was in the hospital months and unable to walk for almost 4. I spent countless nights doing homework at the hospital, but then I kept going forward. Fast forward a few years later, I'm now entering my second year of my doctoral program for my Doctor of Public Health degree. I finished my first semester of my doctoral program really strong. Then I went home for winter break and time off from work, and my autoimmune disease that I was diagnosed with a couple of years back decided to act up. And I had a really bad flare-up. This flare-up lasted 40 days, and I could barely eat, I could barely sleep, I was tired, and my body was just deteriorating before my eyes. But I knew this was also part of my journey. I needed to experience disease firsthand so that those that I am serving know that I do know what they're going through. There will be obstacles that will come along. That's the inevitable. And I knew what I had to experience was so that I could understand health disparities within my communities that I serve. You have to keep going. You have to stick the path. The way in which you keep going forward will determine your destiny.